Or you could just, if you started now, you start talking.
It's live, I think. Let's see. Just trying to test out if I am live and here. This is day 13, I think, of quarantine. Well, for some of us, but some of us are not quarantined. So, I know, Jake. Healthcare workers, essential personnel, lots of people. Hi. This is day, I believe, 10, 13 of quarantine for those of you who have been in the house. And I realize that there's a lot of people that are going COVID crazy because, hi, Elizabeth, how are you? So I just wanted to come on and just kind of, you know, have a conversation, give you some information. This virus is really about how well your body can fight the disease. So there's just a lot of misinformation out there. And when I'm seeing things, I just want to sort of educate everybody. So I'll start with masks. Okay. If you're wearing masks in public places, it's just really important that you remember for your own health, this part of the mask is the dirtiest part. So while you have it on your face, if it's catching anything, you don't want to touch the mask. You don't want to touch your face at all. You want to try to remember that this is the dirtiest part of the mask. So wearing it in public and acting and touching your face, you can cross-contaminate yourself. It's really important that you take it off appropriately and act like there's poop on the outside of this mask so that you don't put a mask with poop on your dining room table, on a counter, on some other surface where someone else can come and touch the mask. So please, please, please be safe out there. And don't just throw it on the ground. If you're wearing it because you don't want to be contaminated, no one else does either. Hey, Glenda. Hey, Sharon, how are you? Listen, I'm taking questions, but I just wanted to give some safety tips to start with. Just please, please, please be safe out there. You know, this is a coronavirus, which is like a cold virus, right? So this is not something that it's going to be gone in a week or two. This is something that we're going to have to learn how to live well with. So, hey, Lauren. Hey, Ben. Hey, Jennifer. Just trying to answer questions. So I did get one question already, and the question was, there are people out here who are living with essential workers. And thank you, Ruthie, for the question. And the question was, how do those of you who are staying in the house with an essential worker feel safe knowing that they're going out and maybe coming in contact with the virus and then coming back into the home? So as a person who has not been quarantined, and I've been out of the house literally every day at work, I'm just going to say that we have a certain responsibility, which is to make sure that we're washing. Hey, Kareth, how are you? Washing our hands and making sure that we use our personal protective equipment when we're at work. And when we touch surfaces prior to coming into the house, I don't walk into the house with my shoes and then walk all over the house. I sort of leave them at the door. I have a mom who she's over, well, getting towards 80. So I definitely want to make sure that I'm not cross-contaminating her. So I, take a shower or take a bath and make sure I'm not wearing the same clothes into my house and around my house that I do at work. Hand washing is going to be essential. Really, really essential. As we're going through this time period, it wakes us up to the fact that, you know what, we have to do the right thing. So for those of you who are quarantined, you're going to really just be conscious about washing your own hands. And here's a tip. Soap works against this virus. It's a very weak virus. Soap and water works. You want to keep your surfaces clear. You want to wipe things like door handles and common areas like toilets. You want to make sure that those areas are cleaned on a regular basis. The thing I also want to share, it says we're all well here and staying safe. Excellent. Glad to hear that. I'm so happy to hear that. Hey, Shalanda, how are you? The other thing I want to share is just about panic. There's a lot of information that's going forth, and I think it's really, really, really important that we listen but not drive ourselves crazy with the information that keeps coming out. I think they're being very wise in giving people definitely information that's going to help keep them safe, but recognizing that, we want to take good care it says, to good care to take care of ourselves. Is it true that the warmer weather will help with the virus? So yes, there is a benefit to the warmer weather because this virus doesn't survive in extreme temperatures like the extreme warmth. So hoping that in the sunlight, certainly outside surfaces that, will have access to sun, that there'll be less of the virus. But our biggest challenge right now is that there are people who are asymptomatic or don't show any symptoms of the virus that are still able to able to catch the virus, and so they're spreading it. So when they talk about flattening the curve, right? Basically what's happening now, and if you're looking at what's happening in Italy or what's happening in Spain, there were no safeguards. People were still sort of interacting with each other even though the virus was in the community. And what happened is the amount of people that got sick overwhelmed the healthcare system. I was watching some videos and there were hospitals that were operating at 200% of their actual capacity, which means if I have a 200-bed hospital, I now have 400 very sick people. It's overwhelming. Hey, Rebecca, how are you? Hey, Sin, how are you? So the curve is just the amount of patients and the time that they're getting sick. And to flatten the curve, we have to decrease the spread. So this whole social distancing thing is just minimizing the amount of people who are spreading the virus in the community so that the healthcare system can take care of them. Recognizing that the very sick, hey, Rebecca, the very sick require ventilator support. Italy right now is being overwhelmed with not having enough ventilators, recognizing that some people are so sick, and it's usually the elderly or people that have other comorbidities. So they're making decisions about if they can put people on ventilators or not. There's a question that says, if you're asymptomatic host, how long does the virus live in you? So they don't actually know exactly how long. The course of exposure. So if you're exposed to somebody, it can take up to 14 days for the virus to show in you. However, the course for your illness and how long you actually have active virus is really different for each host. Hey, Helena, how are you? Hey, Jordan. So they're still studying that, and China has information, Italy has information, but nobody, it's like literally been just months, and you know how long research. Hey, Janine, how are you? The virus has been out not long enough to actually give enough information. Can rain wash out the virus if it's considered airborne? So here's the thing. The virus is technically droplet. However, if you have a procedure that sprays, like if you do a respiratory treatment that has a mist, then the virus can go sort of into the air. So it's generally considered a droplet virus, meaning that if I'm coughing, and this is the way to cough these days, into your arm, or if I'm sneezing, then you're spreading droplets of the virus. So it's technically droplet, but it can be airborne for a period of time. Hey, Rhonda, how are you? The thing I'm seeing, another thing that I'm seeing, and I'll still keep taking your questions as you send them, but there's things that I think that are really going to hurt us as a community. There's lots of people wearing gloves, all right? And I think there's a mindset that if I'm wearing gloves, there's some miracle and now I'm protected. However, gloves can be contaminated. So you should hand hygiene before you even put on gloves. Because if you take a dirty hand and put it inside of a glove, now you're baking whatever germ you had on your hand in your skin with moisture, and it's a bad thing. Then I see people taking them off by touching the outside of the glove, which means you're contaminating your hand, as long as I am taking off the glove, I'm protected. You still have to hand hygiene after you take off gloves. These are clean, but I just wanted to kind of show you. People have to realize that gloves are not a panacea. Masks are not a panacea. If they're getting contaminated, people in China actually inoculated themselves with higher concentrations of germ because they would pull down the mask, open a container, drink something with gloves, push the container back, and then now you have a container that's contaminated, and you're what they call personal protective equipment is contaminated. So please, please, please take off your gloves properly. Hand hygiene before you put on gloves. Hand hygiene after you take gloves off. Hey, hi Hamilton, how are you? Are you staying safe out there? Will this be until, what do you think will be until, when will the cases decline is a question. So it's a virus, and as long as we keep spreading it, it's like a cold or the flu. And I want to say, for those of you who think the flu has gone away, it has not. There's a lot of people that are in the community that are getting cross-contaminated. So recognize that if you haven't had a flu vaccine, you probably should. If you're elderly and haven't had a pneumonia vaccine, you probably should. You want to minimize all of your, you want to optimize your health, let me say that. Are homemade masks helpful? Homemade masks are the same as, when they do health grade masks, they can filter up to really, really small microns. Homemade masks, I think if they make you relax and if you still treat them as if they're dirty on the outside, then I think there's a degree of protection. If someone sneezed in an elevator, you wouldn't be inhaling, their droplets. So whereas in healthcare organizations, homemade masks are absolutely not what you want to do. You want to use the approved mask for your organization in the community if it helps people to move around. But I'm still seeing really bad habits with personal protective equipment, which is putting other people at danger. I can't stress this enough. If you're touching a dirty surface with a glove on, and then you go and touch something else, you're now contaminating that surface. In order to flatten the curve, as you keep hearing about, we're going to have to stop spreading this virus, which means cleansing surfaces as much as possible. It means washing your hands before you touch surfaces and after. PPE is being reused. Should gloves also be reused? Personal protective equipment in some places is running out. So there are some organizations that have found a way to cleanse personal protective equipment. I would say in the community, if you didn't wash your hands when you put your gloves on, the insides of your gloves are now contaminated. You would do better. You have 7 layers of skin on your hands. You would do better to wash your hands regularly than to wear dirty gloves. Hey, Lisa, how are you? Hey, hubby. So, again, it's really important. Hand washing, I can't stress it enough. It's about not spreading it to other people. I feel bad for a lot of elderly people because they're alone during this time. So I really, really encourage folks to just reach out to the elderly, ask them if they need something, help them with shopping. They get anxiety and sometimes they get paranoid. So, put the bag on the porch or however you can get it to them without giving them fear that you're going to contaminate them. But definitely reach out to folks who are alone during this time. So other questions. Now, this is a first time I've done this platform and I've seen questions go by and I want to try to address them. So let me see. Talked about PPE. Clerk in the... Oh, okay, great. Talked about homemade masks. Symptoms. The symptoms of COVID are specifically the danger symptoms. So it's cough, fever, shortness of breath. If you have that combination, you need to seek a health professional because you need to monitor your fever, kind of see if you have a cough. There are other symptoms that I hear people have, but fever, cough, and shortness of breath are sort of the dangers. And if you're able to tell what your pulse oximeter is, the COVID patients that we're seeing coming into the hospital, their lungs are beginning to get filled up and the spaces where air can exchange is not happening. So they come with pulse oximeters of below 90, 93, 94, 80 sometimes. And that's a very, very sick patient. So once you begin to feel shortness of breath, fever, cough, you need to seek help. If you don't have any symptoms and you're just sort of want to go to the emergency room, this is probably the worst time in the history of our country for you to walk into a hospital if you are not sick, right? Because you can, there's a concentration of people who are very sick in those spaces. The hospital workers have personal protective equipment, but it's really not a good idea. So if you have a primary care doctor, you're probably, if you call them now, they're like, don't come, because they don't want you to spread the virus to anybody in their waiting room. So a lot of providers are doing what they call telemedicine. So you can call them, tell them your symptoms, they can send a prescription for you, and you can get better without having to go into a hospital. Quarantine, what does that mean? So if you're quarantined, if you've been exposed to the virus and they tell you that, you just need to be away from people, that's really to avoid spread. So quarantine can be, in your house. Some people are doing it in a hotel. It's just really separating yourself to minimize the risk. If you're in a home where you can't really leave, they really recommend staying in one room so that other people who are in the home are not, breathing what you're coughing out, and also to try to limit the same, toilet and bathroom sort of use. If you can't, then you just really have to sanitize every time you use your restroom. Other questions? Let's see. Talked about the rain. If you are symptomatic host, we talked about that. Let's see where we are with questions here. All right. How are you guys doing out there? News reports said that the nurse at Mount Sinai Hospital died as a result of caring for virus patients. How does the hospital track contact in a case like this? So there are what they call infection preventionists that work in every hospital. Once there's a positive case, most of the patients who are coming into the hospital are coming in as rule out COVID. Once you have the symptoms of shortness of breath, cough, and fever, you're automatically rule out COVID, which means that we take the same precautions on those patients as if you actually had the virus. So once the test comes back positive, every single encounter that patient had where someone might not have been protected, let's say they came in into the waiting room and were sitting in the waiting room, and then when they got triaged, so the infection preventionist would actually track, and somebody's ringing my doorbell, which hasn't happened in 2 weeks. That's rare. Every single person that person has come in contact with without PPE and with, they're sort of giving them the information that, you came in contact with a positive patient. What does that mean if someone calls you and says, this is what has happened? That means that you kind of go into a self-quarantine, so that you're going to monitor yourself from the day that you had contact with that person for 14 days. And what does that monitoring include? You're going to take your temperature twice a day. You're going to, see how you feel. Are you coughing? Do you have shortness of breath? Most of the people, because I've been manning a nurse triage line for a while, when it hits them, they feel like they've been hit by a truck. Almost like if you've had the flu, you feel that. So the infection preventionists or the Department of Health actually contact people who have been in contact with positive people to try to minimize the spread. This national shutdown is, again, to try to do that by forcing people to not be in contact with each other. Hey, another question is, if you are exposed, are they testing if you're asymptomatic? So I'm in New Jersey. I know some of you are all over the world, but in New Jersey, we currently do not have enough tests to test people who are asymptomatic. So we are trying to sort of not really focus and make sure that if someone is sick, we want to be able to quickly rule out, is this COVID or is this just a regular flu or something else? So the tests currently in the hospitals or by the Department of Health, the guidelines have been, we need to test the sick. We need to quickly ramp down how many sick people we have. There are testing centers that are being opened. I know Weequahic Park has a testing center, and you can go on your public health lines and find out where are the public testing centers, and they'll have criteria. I know the ones in New Jersey, they actually require you make an appointment so that they can control the number of people who are coming to be tested, but we are still testing the symptomatic right now. Allergy season is coming up. So somebody's asking, yeah, there's going to be a lot of unpopular people. If you are sneezing in public, trust me, it's not going to be popular. So if you know you have allergies, it'd probably be a good time to get ahead of them and try to manage your seasonal allergies. I was in Costco's today and there was a man sneezing in one aisle. You know I didn't go down that aisle, right? Yeah, no. So any, allergy, cough, those kinds of things, contact your health professional. Try to get ahead of it. If it's a food allergy, try to not avoid those kinds of foods. Is it true that regular masks won't protect you against COVID-19? So it really depends on your circumstance. Okay, so a regular mask is a procedural or a surgical mask. It doesn't have the level of micron protection. So if you were intubating a patient and they're coughing and there's lots of droplets coming out, the best protection is an N95 mask, right? But if you're walking in the supermarket and you have on a procedural mask and somebody sneezes, it'll give you enough protection that you can certainly make sure you wash your hands, because if you touched anything that, a droplet from that sneeze landed on, you want to make sure you wash your hands. So for hospital workers who are doing what we call aerosolized procedures, it is not appropriate to wear a regular mask. But for certainly, average contact, and you're walking through through an aisle, going to get your groceries, that kind of thing, it's, not gonna harm. Hey, Cassandra, how are you? Hey, Benita. Does a pneumonia inoculation lessen your chance of COVID? So that's a great question. So pneumonia vaccine is particularly for viruses that cause pneumonia. The COVID is literally a brand new cold virus, and there are 7 different coronaviruses. This COVID-19 has sort of mutated and is a particularly lethal virus in that it kind of gets into your body, acts like your immune system, and begins to replicate and take up space in your lungs, so that people who are really impacted by it are not able to exchange oxygen, which is what we need to live. So if you need if you're over a certain age, and your doctor will tell you, and you need a pneumonia vaccine, that'll protect you against some pneumonias, just like the flu will protect you against some of the major flus. But COVID-19, there is no vaccine. There's no, they literally are just trying to get ahead of how to manage this. And I kind of think of it, I'm a nurse, so it's a cold virus. We don't have a cure for the common cold. We do know how to minimize spread, but we may be living with this for a very long time. It's really important that we figure out how to manage without spreading it to others. Talked about allergy season. Hey, Teresa, how are you? Hey, Angela, how are you? Hey, Donna. Hi, Denise. Hi, Sierra. Verona Knight. Ooh, how you doing? All right. Let's see. I'm going to say this again because some of you just joined. A lot of people are running around the community with gloves on. All right. If you put a dirty hand into a glove, right, you now are baking viruses in your glove, because gloves make things nice and warm and they're moist. And it is probably worse for you to wear a dirty glove than to not touch a surface, wash your hands. It is very bad. I see a lot of bad practices. And when you go to take it off, if you're touching the outside of the glove, you're contaminating yourself as well. So you don't use your glove that you've been touching dirty surfaces with and open your water bottle, drink. You're not drinking with a dirty glove is like giving yourself an inoculation of the virus. So please, please, please do not wear gloves in the community and act like there's nothing magical in gloves. All right. So taking them off, I'm taking them off wrong right now. You're going to touch the inside of the glove and you're going to peel it off and down and then throw them in the garbage. All right. I talked about the masks a little bit earlier too, that I see people running around with, and they have them under their chin. If you have a dirty mask under your chin, now you have contaminated the under part of your chin or your head or wherever you're wearing it. It's not a fashion statement, with whatever was on the outside of this. And now you go to touch your face, touch your eyes, touch your nose, and you've inoculated yourself. In China, they found people inoculated themselves with higher concentration of virus than they would have if they didn't wear the mask and just washed their hands and avoided contact. So be very mindful of how you wear personal protective equipment, because you're not protecting yourself. You can be harming yourself, and you actually can cause more harm to other people in the environment, because whatever's on the outside of this dirty glove, you're just putting on surfaces as we go across. Burlington County has a testing site now. Cooper Health is testing all inpatients, and no test without a physician script. Okay, so that's literally, the rules on this virus are changing like literally every single day. So good sites to check out are the CDC, your Department of Health, 211 if you live in New Jersey has a lot of great resources. Get your information from good sources, making sure that you're not, driving yourself crazy with like looking it up, but certainly recognizing that you stay informed. So the way that we're going to sort of flatten the curve is to find out who has it, be able to separate those people, allow them to heal or get better, and then to stay and to keep them from giving it to other people. It's really, really important. Hey, Michelle, how are you? I was informed that ibuprofen and Advil is not good to take during this time. Can you confirm? I've seen recommendations that if you're taking, that you should take Tylenol as opposed to ibuprofen. And there's not enough research out there, but there are a lot of health professionals that are saying Tylenol as opposed to Advil. If you have a fever, cough, shortness of breath, you really should consult a health professional. They may not want to see you personally, but you should consult a health professional so that you can just manage yourself, especially if you have other chronic illnesses. If you're an asthmatic, you have heart disease, diabetes, don't just, tough it out alone, especially if you have all three of those symptoms. Seek a health professional. If you are feeling shortness of breath, you need to get to the hospital. I was saying that right now the hospitals are overwhelmed with patients that are truly, truly sick. So if you're truly sick, get there, we can take care of you. But if you're kind of weathering the storm and you're not feeling as unwell, reach out to your health professional. They're actually doing, I'm saying cyber visits, but that's not right. Where they're using the computer and they can, get you what you need. Some pharmacies are like, yes, we're open, but we don't want to see you. So they want you to call them, let them know, what you need. You pay for it online, and then take care of yourself. I'm going to say it's really important that you optimize your immune system during this time. So whatever you do, I'm not a prescribing doctor. My doctorate is in health administration, so I can, organize and help you. And I'm a nurse, so I certainly can give guidance. But if I can say one thing to anybody, it's to optimize your personal health. What does that mean? How can I sort of operate in a healthy way? Meaning that now, if you're a smoker, great time to quit. You already have compromised lungs. This will kill you. So you definitely want to reconsider another addiction. Gum, if you're a person that has diabetes, this is not the time to let it get out of control. So people with other comorbidities do very poorly with this disease. That's not to say that it's not also killing some healthy people, but recognizing they do a lot worse. When you look at the curve as far as the age demographics, kids, for some reason, are unusually protected. So a lot of people are driving themselves crazy. Oh my God, I don't want my kid to get it. Of course we don't. But the kids in China, they have very, very few deaths to children in China and in Italy. If you're 80, 90 and living a good life and have comorbidities, you really want to optimize your social distancing and trying to minimize getting this virus. Hey, Michelle. Hey, Cassandra. Hey, Tina. Teresa, is it true the mask is more for people who have a cough? That's a great question, Teresa. If you are not sure, this virus sometimes has very mild symptoms in people. So if you think, I kind of woke up with a sore throat, I'm not short of breath, I don't have any fever, but I don't feel myself, you would do better to wear a mask to protect other people in case you are infectious but remember to treat that mask like you're actually catching virus. So you're going to be very careful about where you take it off. You're going to try to isolate yourself, and you're going to reach out to a health professional. So if you have a cough, if you're sneezing, absolutely, it's better to protect others because it's unknown, especially if you have not been tested. So absolutely, definitely protect against spreading anything if you're not sure. Because if you're immunocompromised, or if you're just a person that doesn't have a full-blown reaction to this virus, you absolutely want to protect others. And I can't say enough, soap and water kills this virus. Like, we're running around looking for hand sanitizer. Don't go crazy. Like, wash your hands, wipe down surfaces, clean them. It's a very weak virus, and the only way it can kill you is to get inside of you. You have to be able to, it has to get in through your nose or through your mouth, like by touching a surface. Otherwise, wash your hands. If you wash your hands and it doesn't get inside, it cannot harm you. Hey, Ruth, how are you? Hey, Tanya. Linda, hey. What about patients who have frequent blood exchanges? What precautions should they take? So anybody who's entering a health facility is going to guard themselves against surfaces. They did a study actually, and if you're a patient in a facility, you would do better to ask every health professional that comes toward you, have you washed your hands? Because that's going to make a difference. You don't want somebody bringing a dirty, hand or instruments to you. So if you're someone who has to interact with the health care system, you take your precautions, wash your hands. Do not be embarrassed to ask someone if they have washed theirs. If you haven't seen them do it, then ask them. Like, I'm not offended. I'd much rather have you see me wash my hands in front of you than to say, oh, I'm just going to go forward. This is life and death. So someone who does have chronic health issues, you're taking precautions. You're trying to make sure that you stay as healthy as possible. So I would ask those questions. A teething baby in the house. What's the best cleaners to use on surfaces for toys? For any toys, especially if they're wipeable, soap and water is fine. Those Lysol wipes are fine. If you use a cleaner with a disinfectant in it, just be observed to let it dry. You know what I mean? Like, make sure that you let it thoroughly dry before you let the baby, play with it again. But like washing the toe, I would just throw all the teething toys in like dishwashing liquid and wash them up and dry them so that they're clean to use, making sure that your hands, when you go to give it to the baby, are clean. All right. Verona says, the mask is not a fashion statement, and that is, I can't say that enough. We will do more harm to others by wearing masks inappropriately. People perish for lack of knowledge. That's so true. Hey, Kathy, how are you? Hey, Adrian. Lots of great questions tonight, guys. This is really, really good. And I think we can do a lot to just sort of share this information. The thing I want to remind people is that we have to help each other. Sometimes you don't even realize. Like, I walked in my house today and my mom quickly reminded me that I was outside and now I'm walking around the kitchen with my shoes on. So I took heed to that. I went and put them down, and then I washed down my kitchen floor. I do not want to harm anyone in my home, recognizing I'm going into a hospital every day. Can you wipe down surfaces with soap and water? Absolutely. This is a weak virus. It gets killed when you use cleansing agents. So yes, wipe down surfaces with soap and water, recognizing that you should thoroughly rinse and make sure using Lysol wipes or other non-harmful wipes is appropriate. Better to wash than to wipe a surface. Hey Bev, how are you? All right. What advice can you share with those who are suffering psychologically, or maybe suffering anxiety from catching the virus? And I want to say that this is so critical, right? If you've ever watched a movie of a roller coaster, your mind doesn't know whether you're really on a roller coaster or you're not. So what I would give advice to people who have anxiety, if you have psychological or mental health challenges, this is not the time to suffer through it. Seek your mental health professionals. If you suffer with anxiety and you have not gotten help before, this is a time for you to really understand that there's no shame in getting help for whatever anxiety. I will say that getting good information and giving your mind that information, the truth, is better than letting your mind race as to how you're going to die from this, whatever this cycle, because your body doesn't know whether your mind is telling you the truth or not. So your reaction is going to impact your immune system, your psyche. It does not help you to be more depressed, to be more anxious, to have your heart racing. I had a person that called me the other day, and her blood pressure went through the roof. She was worried about, she had passed somebody in the hallway that had been diagnosed. First of all, that high blood pressure, that heart rate of 185 was a real reaction, but it came from her mind telling her, I'm going to die because I passed somebody in the hallway. Stop it. You have to give your mind facts. You listen to your body. You monitor your temperature if you've been exposed. If you have shortness of breath and you have a cough, you're going to deal with that. But do not spend your time thinking about what could happen to you. There's so many people who think, what if I die? Stop it. What I'm going to say is, if you need help, get help. If you want to speak to somebody, reach out. I do personal conversations. I literally have conversations with people every day. And it's really all about, what am I telling myself? There's a verse in the Bible that says death and life are in the power of the tongue. So if you're saying to yourself, oh my God, I'm going to die. Stop it. All right. So again, there's no shame in seeking help when you need it. Hey, Ray, how are you? Hey, Kathleen. All right, guys, you guys have been absolutely amazing. What I'm going to say is, stay safe out there. Wash your hands. If you have other questions, I'm happy to answer them. I think I covered, let's see. I think I covered a lot. We talked about not using PPE inappropriately. Let's go back. We talked about doing whatever you need to calm your anxiety, right? So if you need to watch funny videos and stop watching the news and begin to give your mind something positive. If you have people who are at risk, kind of setting up your home now so that you can minimize the risk, cleaning surfaces and surfaces that you don't normally think about, right? Like your doorknobs, your bathroom. These are things that if somebody is leaving the house on a regular basis, you want to keep up with those cleaning items. All right. Any other questions? This is my first time doing this, and you guys have been amazing, so I thank you for this. Talked about allergy season. All right. So I want to give a little bit of guidance if you are pregnant, and how to protect yourself while you're pregnant. It's really important that you follow the same guidelines that I've been saying, right? So regularly wash your hands. You're using, soap and water. Clean and disinfect surfaces regularly. You're going to monitor yourself. Sometimes pregnant people can get fever, but if you have fever, cough, shortness of breath, any other, you just kind of know you're not right, reach out to your health professional so that you can get help. Really avoid contact with people who are sick. And this is just something you should practice anyway. Pregnant women should not be in contact with people who have chickenpox or any other viruses, and this is very similar. So if you are pregnant and someone in your house has been diagnosed with corona, you want to, make a plan. You do not want to stay in contact with that. We talked about if you have somebody that you love that is going out every day, just making sure that you wipe down surfaces, and that person is also protecting themselves when they walk inside and making sure that they're not exposing themselves. I'm personally taking vitamin C. I'm doing warm fluids. Very important for you to hydrate yourself. This virus, if it gets into you, it can sit in the back of your throat. If you swallow it, your stomach acids have killed this, all right? But if you let it sit there, you let yourself get dehydrated, and then you inhale it into your lungs, you're starting a very, very bad process. So recognizing that hydration, warm fluids, citrus fluids, all the things that you need to improve your immune system are going to be really helpful during this time. All right. Let's see. If you have been in your house for an extended period, are you still washing your hands every 20 minutes? No. So I didn't say how often you needed to wash it. If you're out in public, certainly after you've touched surfaces, you want to do hand hygiene. If you've cleaned your whole house and you're, sitting in your house, it's not, unless someone with the virus comes into your home, you don't need to wash your hands every 20 minutes. So, no, a good question. All right. Anybody, so the question is, are lupus patients at risk? So certainly anybody that has an immunocompromised, if you're taking chemo, if you're, have a chronic illness, you are more at risk than someone who doesn't. So you would take extra precautions, recognizing that anybody coming into your space that's coughing or sick is that's not a good thing. You want to protect yourself, especially when you're immunocompromised. So I will, can you hear me? Okay. Sorry, a call started coming in. So I will be happy to do this again. If you have other questions, you can always just inbox me. Stay safe out there. I want to thank you all for tuning in. This is my first Facebook Live Q&A, but I'm happy to do it. And just remember, do not use PPE poorly. Treat your gloves like they are also contaminated. Wash your hands, enjoy each other, and utilize this time to find some special gift about yourself, because I am just amazed at the number of things that are happening because of people being quarantined, people getting together. So thank you so much, and God bless.